Bismillahirrahmanirrahim. Our today's topic is the introductory lecture about pharmacology. Pharmacology is concerned with the action of chemicals on biologic system. Medical pharmacology is concerned with the action of chemicals that are used for the prevention, diagnosis and treatment of diseases. And then we have another term known as toxicology. The undesirable effects of chemicals or drugs on our body is included in toxicology. So, we discuss about the pharmacology and toxicology. Then we have two terms which we study in pharmacology: pharmacokinetics and pharmacodynamics. So, first we have pharmacodynamics. Pharmacodynamics is concerned with the action of drugs to our body. It means that pharmacodynamics is what the drug does to our body. Pharmacodynamics include what the drug does to our body. In pharmacodynamics, we study about the drug receptor interaction, how the drug interact with the receptors in our body, and dose response phenomena. It means that how much drug we are going to take, dose response phenomena. And the another term, therapeutic and toxic actions. All these we discuss in pharmacodynamics. Then we have pharmacokinetic. Pharmacokinetic is the action of our body to the drug. So the difference should be clear. Pharmacodynamics is what the drug is doing to our body, and pharmacokinetics is the action of our body to the drug. In pharmacokinetics, we study four phenomena: the absorption of drug, the distribution, metabolism, and elimination. In pharmacokinetics, we have four phenomena. First phenomena is the absorption. The second one is the distribution of the drug. The third one is the metabolism, and the fourth one is the elimination of a drug. So we have a term known as biodisposition. Actually, biodisposition is a term sometimes used to describe the process of metabolism and excretion. So, biodisposition is a term that describes the metabolism and excretion of the drug. Now we are going to discuss about the nature of a drug. Before discussing the nature of a drug, we should have a clear concept about what is a drug, what is a drug receptor. A drug is a substance that act on biologic system at the chemical or molecular level and alter their function. A drug is a substance that act at a molecular level and alter the function. And then we have a drug receptor. A drug receptor is a molecular component of the body with which the drug interact and bring about the effect. So we discuss about the drug and we discuss about the drug receptor. Now in the nature of drug, we discuss that most of the drugs are alkaloids in nature. What is the meaning of alkaloid drugs? Alkaloid drug means that they are basic in pH. Okay, they have basic pH in solution. Usually because of amine groups. And the second thing we discuss in the nature of drug is that the most of the drugs are optically active. What is meant by the optically active drug? It means that they have one or more asymmetric centers, and those who have one or more asymmetric center, it means that they can be exist as enantiomers. So most of the drugs are alkaloids in nature and optically active. They have one or more asymmetric centers and can exist as enantiomers. Now discuss about the size of drugs. Drugs vary in size. They have a molecular weight as low as 7 to as high as 50,000. The 7 molecular weight like that of lithium, and 50,000 molecular weight as that of uh, enzymes and antibodies or other proteins. Now, most drugs have 100, molecular weight 100 to 1000. Less than 100 molecular weight drugs are very selective, and more than 1000 molecular weight drugs are those that are poorly absorbed and poorly distributed in the body. Then we have drug receptor bonds. Are three drug receptor bonds: the very strong covalent bonds, then we have weak hydrogen bonds, and then we have very weak van der Waals forces interaction. So this is the introduction to our pharmacology.